If you are experiencing a relentless burning sensation in your feet, unexplained balance issues, or a chronic, exhausting brain fog, you have likely walked a very specific medical path. Your doctor probably checked your fasting blood sugar, perhaps ordered a standard nerve conduction study, and ultimately handed you a prescription for gabapentin or pregabalin. If those tests came back normal, you were likely told that your nerve damage is idiopathic, which is simply a clinical term meaning we do not know what is causing it. But what if the actual culprit is sitting on your dinner plate every single day? What if a common dietary protein is systematically dismantling your nervous system, even if you do not have a formal diagnosis of celiac disease? In my over 30 years of clinical experience across anesthesiology, interventional pain, metabolic health, and addiction, I have operated on a foundational principle. Pain is not a diagnosis, it is a signal. It is an alarm bell telling us that something in your body's structure, metabolism, or lifestyle has drifted profoundly out of balance. Today, we are going to look past the standard medical assembly line and examine the hard, peer-reviewed data linking gluten exposure to progressive nerve damage. To understand this connection, we must first shatter a massive medical myth. Most clinicians are trained to believe that gluten only causes harm if a patient has celiac disease, an autoimmune condition characterized by severe destruction of the intestinal villi. Landmark research in the Lancet Neurology has conclusively demonstrated that gluten sensitivity can manifest purely as a neurological disease. Up to 60% of patients presenting with neurological dysfunction of unknown origin test positive for anti-gliadin antibodies while showing no signs of celiac disease. Let us dive directly into the three distinct cellular mechanisms that allow gluten exposure to destroy your nerve tissue: immune cross-reactivity, intestinal permeability, and nutritional malabsorption. The first mechanism is immune cross-reactivity, or molecular mimicry. When you ingest gluten, your immune system views gliadin as a dangerous foreign invader and generates specific antibodies to target it. The structural tragedy lies in the amino acid sequences. The molecular structure of gliadin closely resembles certain proteins found naturally within your own healthy nervous system tissue, specifically synapsin and gangliosides. Because of this mimicry, anti-gliadin antibodies begin to mistakenly target, bind to, and attack your own nerves. Your immune system accidentally launches an autoimmune assault against your own internal wiring. The second mechanism is the destruction of your internal barriers, commonly known as intestinal permeability, or leaky gut. Research pioneered by Dr. Alessio Fasano at Harvard Medical School revealed that when gluten is exposed to the gut lining, it triggers the excessive release of a master regulatory protein called zonulin. Zonulin acts as a key that unlocks the tight junctions of your intestinal wall. This allows toxins to pass directly into your systemic circulation. Your immune system immediately identifies these misplaced particles and launches a massive, continuous inflammatory response. This causes a surge of circulating inflammatory signaling molecules, including tumor necrosis factor alpha, interleukin-1, and interleukin-6. The third mechanism is the silent starvation of your nerves through nutritional malabsorption. Even in cases of non-celiac gluten sensitivity, chronic low-grade inflammation within the gastrointestinal tract impairs the expression of specific nutrient transporters. This directly leads to deficiencies in vital B vitamins, including vitamin B1, B6, and B12. Vitamin B12 is absolutely non-negotiable for the synthesis and maintenance of the myelin sheath. When levels drop, the myelin begins to unravel, exposing the underlying nerve axon to direct, irreversible damage. Now that we understand how this damage occurs, let us map out exactly how it manifests in the human body, starting with the central nervous system. One of the most profound manifestations of gluten exposure is cerebellar ataxia. The cells within the cerebellum, specifically the Purkinje cells, express an enzyme called transglutaminase 6. When your body develops an immune response to gluten, it often produces antibodies that specifically target this transglutaminase 6 enzyme. As a result, patients experience a progressive loss of balance and motor coordination. They may experience an unstable gait, difficulty walking a straight line, clumsiness with their hands, and slurred speech. Peer-reviewed statistics show that gluten sensitivity is the primary underlying cause in up to 40% of all cases of idiopathic sporadic ataxia. Looking down the chain, gluten exposure is a leading driver of peripheral neuropathy. The damage frequently begins in the small, unmyelinated nerve fibers responsible for pain and temperature signals. When these small fibers are damaged, they misfire erratically. This is why patients report classic sensory symptoms, such as an intense, relentless burning sensation in the soles of their feet, sharp electric shock-like pains, and icy numbness. Removing gluten is only step one. Human nerve tissue heals at an agonizingly slow rate, typically only 1 millimeter per day. You must address the entire cellular terrain to truly reverse the trajectory of neuropathy. If you want to break out of this cycle and find out definitively if gluten is driving your nerve damage, you must pursue an advanced, data-driven diagnostic strategy. First, consider HLA-DQ genetic testing, and second, demand an expanded, comprehensive antibody panel including trans-glutaminase 6. Do not let your health be dictated by an assembly line model. Look at the data, test your internal terrain, and take control of the variables that allow your body to heal. Thank you for tuning in to Regenerve.com. I am Dr. Padda.